thank you, everyone, and in particular the IDE2 Foundation for giving me the opportunity to present this data on the correlation, let's say, between inflammation and the B-cell phenotype. You have just heard from Joanna that inflammation from one side and immunodeficiency, B-cell phenotype on the other side, are somehow two clinical aspect characteristic of the IDE2 deficiency. And more importantly, it seems that together with inflammation, so that they are not actually only correlated, but they can be two phases of the same coin. And this is just to recall you that without treating inflammation, you see a lack, a progressive lack, a progressive reduction of B-cell function, and the opposite when you treat inflammation. But what do we know? What is the background about the possible relation between inflammation and B-cell function? We know that together with T-cell, it's becoming clearer that also cells of the immune system, of the innate immune system, help B-cells to produce immunoglobulin. And moreover, it is also known that inflammation actually affects the coordinated maturation of leukocytes in the bone marrow, promoting myelopoiesis versus lymphopoiesis. And it has been shown in many murine models that TNF and L1 beta substantially reduce the number of lymphocytes in the bone marrow, in particular B cells. And as you probably know, in the peripheral blood, monocytes are cells that selectively express AD2. Here you can see an immunofluorescence of cells, FACS sorted from the peripheral blood, so granulocyte T cells and B cells. And as you can see clearly, monocytes are the only cells that express AD2 into the peripheral blood. And they secrete, as you know, more for TNF-alpha. We enlarged this analysis to cells from the bone marrow, and so we did the same experiment. We sorted granulocyte T cells and B cells, and also in the bone marrow, actually the only cells that expressed AD2 result to be monocytes. And we also performed RNA-seq on monocytes from healthy donor and AD2 to see if the cytokine profile of these monocytes AD2 bone marrow monocyte of AD2 patient, somehow they express a different inflammatory pattern. So going back to the naive B cells, you have learned that AD2 patients, they show an increase in the percentage of the naive B cells, but actually it's not only an increase in the percentage, but also these cells are quite different. Because if you see the expression of IgM, IgD into the plasma membrane of naive B cells from AD2 patients, actually they express more higher level of IgM and IgD, and it is known that IgM and IgD level is the expression of this IgM and IgD is modulating during B cell development. Then we wanted to know what actually are these IgM high, IgD high naive B cells. So we analyzed the expression of several molecules expressed by B cells and important for the function of B cells, and we found a very nice correlation between IgM expression and CD73 expression. So you can see that the more the cells are IgM high, and the less they express CD73. And so then we hypothesized that if this overexpression of IgM IgD could be actually, and this is what you see in AD2 deficient patients, so together with, and in agreement with the correlation of the two molecules, together with an increase in the expression of IgM IgD, you see that all the cells are actually CD73 negative. And so can this represent a sign of perturbed bone marrow maturation? You have just heard that actually these patients, they often have a perturbed bone marrow maturation, especially in B cells. And so we profit from this clustering of CD73, and we sort the CD7 naive B cells, CD73 plus or negative, and then we perform this analysis that is the quantification of the replicative history of CD73 plus and CD73 neg, and actually IgM high CD73 neg naive B cells are actually less measured than the CD73 positive cells. And in agreement with these results, also cells, B cells from the bone marrow or the cord blood, so immature B cells, they lack expression of the CD73. And interestingly, in agreement with what observed for the immunoglobulin level, also the expression of the CD73 is actually restored by the treatment with anti-TNF. So this is, on one side, what we observed in the peripheral blood, but we are also working in the bone marrow, but we are also working in the periphery, because we observed that macrophage polarization actually is strongly affect the ability of macrophage to mediate B cell help. Here we performed the macrophage polarization, and we co-culture B cells with M1 or M2 macrophages, and actually the two different kind of macrophages, they are different in mediating B cell help activity. And then we went to a germinal center so this is a tonsil from an healthy donor, and we performed immunohistochemistry for ADA2 expression in germinal center macrophages, and here you can see that macrophages in the germinal center are highly positive for the expression of ADA2. These are tangible body macrophages in the germinal center. And without ADA2, actually the germinal center, so secondary follicles in the lymph node of patient with ADA2 deficiency, they completely lack the formation of germinal center and secondary lymphoid organ. With this, I go to the conclusions. And so together, this result indicate that hypogammaglobulinemia in the AD2 can be the consequence of an altered bone marrow homeostasis that leads to impaired B cell development and differentiation, not a consequence of an intrinsic B cell defect. The treatment with anti-TNF can improve B cell function, let's say cooling bone marrow inflammation, and and they also give us some new light on the crosstalk between systemic inflammation on one side and adaptive immune response on the other side. With this, I go to the to final acknowledgement, and I want to thank all of you and all these guys.